this process can either be part of the problem or part of the solution in health and disease. I'm going to explain why that is. I'm Dr. A. This is my YouTube channel. So the first thing is that ferroptosis is a subtype of programmed cell death. And you might think, cell death, don't we want our cells to stay alive? That might be a good thing. Yes, we want our cells to stay alive, but our body has this way of constantly regenerating and kind of cleaning out the old and taking it out and building new. And we've learned even in the last 20 or 30 years a lot more about all those processes that happen. But ferroptosis is now a fairly newly discovered part of the cell death and reparation cascade, okay? So it's different than other types of cell death. And in about 2011, 2012, the cell death research community accepted that ferroptosis is actually a unique type or style of cell death, which helps the body then to identify the dead cell and immunologically remove it. And so now, since that time, which now is going on over a decade, we hear more and more and more about ferroptosis and maybe taking advantage of ferroptosis in cancer or some other diseases or slowing ferroptosis down, stuff like that. So we want to go through why. Okay, well, I think the place to start is, how does ferroptosis really work? Well, it works through lipid peroxidation, which is a big word just meaning that your cell membranes are made of lipid particles. Now, they're not all lipid, but they're largely lipid. There's a phospholipid, phosphates and lipids, etc. If I have lipid peroxidation, what that means is that the cell membrane is a living, moving thing, and it's made to be fluid, but the fats inside are these long structures. They look like kind of the long zigzag, and it turns out that that type of a structure is really good at taking on free radicals. Now, normally we have a system we'll talk about later that neutralizes those free radicals, but if we keep bombarding the cell with radicals, then we create lipid peroxidation. Now, you might have heard of hydrogen peroxide used to clean something or whatever. It's kind of like the formation of a peroxide because of these free radicals that build up. Well, then what happens is, in a ferroptosis, there is an actual iron-triggered mechanism which takes advantage of the cell getting all this radicalization, all this peroxide buildup, and then it basically starts to undo the membranes and the cell falls apart. That's ferroptosis in the simplest terms. Why do we need programmed cell death? Well, the main reason is to clean up when things are not going well. So you could think of it this way. Ferroptosis has a purpose. If I'm constantly beating up on a cell membrane and I'm building up all of this radicalization and reactive oxygen, peroxides, etc., maybe that's a cell that's just getting too sick and we need to have it go away. Okay, that's why. How do we normally do that? Well, normally what the body does is it has this, I call it triplet because it's three things, and it's crosstalk between the cell membrane and the fluid areas above and below the cell membrane. And so you have two water-soluble guys in the triplet that take care of the fluid areas, and that is vitamin C and glutathione. They can be on both sides. And then you have one water-soluble guy that is in the lipid membrane because it's fat-soluble in there, and it is a fat-soluble antioxidant in the tocopherol family. You probably have heard more of it as vitamin E, which is fat-soluble. So we move from the outside water-soluble to the inside of the membrane lipid-soluble, and that's the vitamin E family. Tocopherols, tocotrienols are the big family. Okay. Now, here's the reason that they're a triplet. They all take radicals from each other. So if I am in the membrane, fat-soluble tocopherol, that vitamin E takes up a free radical inside the fat-soluble membrane. It saved me from lipid peroxidation in the membrane, but then it can pass off that radical to either glutathione or vitamin C and get it out. And that keeps the membrane healthy. And then glutathione, vitamin C can actually recycle each other. So let's say vitamin C picked it up, glutathione can help. Let's say glutathione picked it up, vitamin C can help. That's why these are also important, and you can't just have one to fix the problem. So that triplet, the two water-soluble solubles, vitamin C and glutathione, fat soluble vitamin E family, tocopherol, tocotrienol. Those guys are how we normally keep from just having ferroptosis all over and, exploding and not being here anymore. So we kind of know now that ferroptosis basically uses the oxidation of lipids to help to break a cell apart. What would speed this up? Well, you can speed it up by lowering the amount of vitamin E family. You could speed it up by lowering vitamin C, which is easy to do in chronic illness. But the main way in the research that's studied is lowering the inside the cell glutathione availability. And there's particular ways that your body puts the makings of glutathione into the cell so the cell can assemble glutathione, because glutathione's 3 amino acids, so it has to, put those in there, and then there's an assembly process, right? So the middle rate limiting, meaning if I don't have this guy, I can't make glutathione amino acid, is cysteine. If you've ever taken like cysteine or N-acetylcysteine to support something, it smells real sulfury. It's a sulfury amino acid. And if you look at glutathione, the remnant of the cysteine is there in the middle with the sulfur right on top of the molecule, depending on how they draw it, right? The target that most are looking at to increase ferroptosis is to target either the glutathione itself or the little transporter that helps the cysteine get into the cell. And so then you think, well, wait a minute, this is a process that takes my cells apart. Why would I want to target this to make it happen faster? Well, we want to get into that. And what we want to think about in respect to that, since they discovered it in around 2012 or so on around there, scientists have looked at this, and it's kind of the shiny new cell death mechanism on the block. And so what would be one place we might want to have more cell death? That would be in cancer. Right? So the thought is, if we can find targeting systems that would increase the iron activity, ferroptosis being iron-based, and then decrease the glutathione and the cysteine ability through transporters and other interesting cell biology, then if we could target that onto cancer cells, maybe we could blow up more cancer cells, which is a wonderful idea, right? So that's where it started to get a whole lot of focus. Now, obviously, there's also normal ferroptosis, which is just if I beat up on your cells too much and they get a lot of peroxidation, they're going to fall apart through this ferroptosis. That's sort of the usual purpose of programmed cell death. But here's, I think, the most important way to think about this, because there are books that are written now that ferroptosis has been around for a while, especially in the cancer community, where it sounds like we should just do a ton of ferroptosis-based treatment, and then that might make all of the cancer go away. Well, in a sense, ferroptosis-based treatment could be really useful in the cancer setting, but you can never have just one side of an equation in the human body. You can't have either no ferroptosis or all ferroptosis. You have to have this balance. Also, in the world of cancer research, they're still trying to sort out what the best way to target a cancer cell and its ferroptosis is versus your normal cells. So just like with other cancer-type therapies, you have to be careful about collateral damage of the normal cell. So in some cases, the way that we consider working with this is we consider what keeps a healthy body from having ferroptosis when we don't want it, and that is the antioxidant support of those 3 big ones we talked about, and then other family members. And so that's glutathione, vitamin C, and vitamin E, or the tocopherols for the fat-soluble membrane. So that's the main way. But then let's say we did want to have a phase where we really wanted extra ferroptosis, maybe to kill some stuff or remove some bad cells, etc. What would be ways we could stimulate that? Okay. Well, there's a number of really deep, sort of picky things in the world of cell biology and cancer research. But just to kind of simplify this, is you often in cancer can do a plus-minus type of a therapy. So remember, we can't have all ferroptosis or no ferroptosis, or we would be damaged either way, or maybe even dead. But the idea is that we may want to cycle ferroptosis-inducing treatments to kind of bang away on the cancer. And then we want a cycle of rest and restoration so that our normal cells have a chance to kind of regenerate, etc. But the way in my looking at it clinically, watching people try and do it, etc., to do it appropriately, is to look at it as a tool, number one, to remember that it can have collateral damage to my normal cells. I don't want to, have too much of it. And to use it in this balanced manner of kind of a push-pull, where I'm going to push on the ferroptosis through glutathione depletion and other things like that. And then I'm going to have a period where I rest the body and restore it. There's three things I think that are important. So the first thing is that ferroptosis seems more simple than it really is. Number two, if we're going to use it therapeutically, we have to use a push-pull, a plus-minus kind of a therapy strategy to maximize both sides so we don't inadvertently harm the patient in the process. And a quote from some ferroptosis researchers, the quote says, "However, there is still a long way to go before the practical application of ferroptosis can be made." And what they're saying is, look, we're still messing with it. We're still trying to figure out how to turn it on and off. Still trying to figure out how to do that in a way that harms the cancer but doesn't harm the human. And so it's a really exciting thing. It's something we're going to see, I think, blow up in the world of cell biology, cell death biology, but cancer care, etc. But we got to remember it's a pretty new toy, if you will, in the cell biology world. And so we have to keep in mind balance. We have to keep in mind that we have to keep our healthy cells normal, and we can't always deprive them of the things that might turn ferroptosis on.